the analysis of kind of what our community board is about, and then 2 sheets is going to talk about population loss, which we'll hear in a minute. But I'm Susie Bowman. I get to say my new title. I am the Director of Regional Impact for the Create Foundation. I'll be starting with them next month, so probably if you've been in meetings with me before, I didn't have that role until just recently. So I get to kind of do this work full time for a living now, and so this is really exciting. Regional and community development, and I love this crowd here tonight. So I'm so excited that y'all are here. So we're going to kick off because we've got some big guns in the house with us tonight. They're going to give us some updates. Just so you know, if this is the first time that you've been to a Community of Excellence initiative, we received $10,000 from our partners of TVA and Create Foundation, have gone in to kind of spearhead this effort across the region. We're one of six now that are doing the Community of Excellence initiative. We've been doing this for a year. It's kind of crazy. We were thinking about that. Our first forum was back in August, end of August of last year. So we're kind of a year in. So even if this is your first meeting, we're really excited that you're here. You're going to get to kind of see what we've done over the last year. So when we first had our community meeting, we got to come in. We had a great group. We actually had probably about 50 people that night come in and give their opinions of what we were doing great in Union County and what we really needed to improve on. This was the list that came up a year ago. So tonight you're going to get to hear a little bit how we tackled some of these topics, how we still need some input on how to tackle some of these topics moving forward. So we're going to talk about all that tonight. So, Mr. Lewis, I'm going to bring you up. Mr. Lewis is with the Create Foundation. I'm going to have the pleasure of working alongside him in this effort for all of our counties across the region now. But tonight we're going to focus just on Union County. He's going to talk to you a little bit about population.
Thank you. I appreciate it, and I appreciate the opportunity to be with you tonight. I've had the opportunity to make 4 presentations in the last 15 years about Union County. The Albany here in Union County. And every time the tone of my remarks has been positive, and that's not going to change tonight. We're doing some great things. One overall benchmark about how well our community is doing is population growth. So if you look in your handouts, pull up this one that shows several red ink on it. It shows a list of counties in northeast Mississippi. Shows what the population was in 2010 and 2023. That percentage is the change in population between those 2 dates. That's not an annual rate. That's how much you need to decrease or increase. The numbers in red indicate the losses in population, and unfortunately, 12 and 17 counties in our region lost population at that time. So you can see down at the bottom, northeast Mississippi, when you total the population lost about 46 basis points, almost 1.5% during that time. The state of Mississippi lost almost 1%. If you remember the 2020 census, which was not a good census because of COVID, but nevertheless, that's all we got. Mississippi was one of 40 states to lose population. All the other 47 grew. So that's the backdrop. But the good thing is, you're one of the 5 that grew. If you look at Union, your population grew by 4.24%, and that's really good. The stars were the 2 university counties, major universities, Occidental and Fayette. They grew at a much faster rate. When you look at the national rate, it's over 8%. It's sad to think that we got a lot of work to do in some of the counties to boost that population. Now pull out the other sheet that says population at the top. I want to get your input. Light Union and the blank at the top. And get the X mark by grew moderately. So 5 choices. So you X out grew moderately. And between 2010 and 2023 grew the population. Now tell me why. You don't have to consult with anybody. It's just off the top of your head. It's not going to put your names on this. We're going to collect these and summarize them. We're going to do this exercise today with a lot of people throughout the region. If Union County is growing, there's going to be room supply. So So, don't dwell on the negative, dwell on the positive.
Industry.
Pardon?
Industry.
Anything you want to, it's why. Anything you want you don't have to even.
School teachers are gonna tell you this out loud, personal, and
You can do anything, you can say anything you want. Anything you want.
And while y'all are working on that, I would love to just go around the room, because I know we have elected officials in the room tonight, but both of our school superintendents, I'm really excited about this group here tonight. So as y'all are kind of filling that out, let's go around the room and just, you tell us your name and who you're with, the organization, or if you're just a community supporter. I'd love to kind of know everybody who's in the room. You can start.
I think everybody knows me. I'm Kim Sanders. I'm Billye Jean Stroud, Director of Community Development in Main Street, the City of Albany.
Keith Conway, I'm the owner of the bar here in Albany.
my name is Stevie Bliss, and I'm
How do you apply in your town?
Drew Warren, all of the Ward 2. Mark Smith, teacher and alderman. And that's us.
Grace Bowser, workforce building coordinator for Albany. I'm Rachel Ray, and I'm Rachel Ray.
I'm John Rogers. I don't really know because I'm a jack of all trades. I'm a teacher. I'm a bus driver. I work with the Main Street Association. I'm kind of a volunteer of anything I can get my hands on.
Kenny Stanfield, Albany Main Street.
Thanks to Kim Baptist.
I'm a basketball coach at the high school, and I'm a teacher at the middle school, and I'm also the team director.
Well, common boys with Billye Jean Stroud, there's to live everything for.
I'm Janet Bell. I'm retired from the hospital. Scientist.
Tracy Brooks, position for the Institute, and we're partnering.
I'm Kay Parks, and I'm the
I'm Bill Rennick, I'm a part-time resident of your fair city. And I'm
Bill is newly appointed by the president, board member of TVA.
And my dad. Andrea Rose with Abolition Regional Commission.
Betsey Hamilton, just Union County Neurologist. Leah Thompson, a citizen and artist.
Community service, citizen service.
There we go, she over here.
Minerva Graham. I'm a lifelong citizen of Union County.
I thank y'all again so much for him. What a great group. Okay. Susie. Oh, did I miss? Okay, so but she's gonna speak of it at the end.
Sam Creekmore, I'm a big fan of her.
We saved the best.
How does that pass your sheets out for this end?
Go ahead.
Hey, I'm Jane Constant. I'm the brand new Union County Development Association coordinator.
And I'm Mark Whiteside, fire chief.
Great. All right, so was that hard to do? To fill out that form? Because we filled that out last week, Markel and I did, with the commission. But I had a lot of pride filling that sheet out, being from Union County. I did. So there's a lot of amazing things going on here.
I wanted you to turn in those sheets because I want to give you what I see as an outsider. So that's positive. That's the difference of Union County and New York. Think about it. Quality of your two public services. I-22. A vibrant downtown. Toyota. Regards to Highway 15 improvements. They're going on south. Have been sometime between here and Hoggot. And we were just in Whitfield last Wednesday. They're breaking ground on a $195 million project. Eventually, Highway 72. Got a strong banking environment, not only in terms of the services they provide, but also the money and involvement of time. Thanks for this. Tanglefoot Trail. Betsey Hamilton, founder of that. That's been a great thing. I know a person in Houston who's got, at the end of the trail, has about 6 rooms, a nice place to sit outside with 5 pits and all that. She showed me her phone of where people have come from. Maine, Washington, Oregon, all throughout the United States. I was blown away. I couldn't believe somebody would come all that way to ride 44 miles back, but they do. And now there's an effort to push it on to Whitfield. You've got strong churches, your healthcare resources, proximity to Oxford, Memphis, and Tupelo, and Unite, which is a CREATE affiliate, is your community foundation, and it's made grants of $520,000 from its endowment since the time it's been in business. So, in my opinion, it's critically important, since you've got so many positives, to not sit on your laurels, but use those strengths and build from that. You have a wonderful opportunity to step up to the next level. And you can do that partially, I think, if not wholly, through the Communities of Excellence program, because it lets everybody have a voice in identifying issues and in dealing with them. Billye Jean Stroud and Susie Bowman have done a great leadership job in the Communities of Excellence, but they need your help. One of the problems is people don't want to step up. They don't mind serving, say, on the task force, but they don't want to be a leader. You all can be a leader, and you can get support from a lot of partners that we can pull support from. 5 partners we have are CREATE, Appalachian Regional Commission, Tennessee Valley Authority, University of Mississippi, and Mississippi State University. And they have all been used, and we appreciate that very much. And they're there. All you have to do is pick up the phone and call them. If you can't find them, find me at CREATE Foundation. So I will say the one negative that stands out to me is the lack of housing. And I don't mean just affordable housing, because everybody mentions affordable housing, but I mean, if you don't get a handle on that some way and provide housing at all price levels, it's going to really hurt your future growth. You're not the only one. Several of our communities of excellence are facing the same problem. In fact, I think the lady in Patsy Gregory in Chickasaw County called several people together recently to talk about that issue. The other communities that are involved in this are Alcorn, Corinth, Lowndes, Columbus, Ripley, Temple, Chickasaw, and Pontotoc. She's already told you about the $10,000. CREATE and TVA are each putting up $100,000. We have a $200,000 fund. We've already given $10,000 checks to the 6 communities, and we're holding that for the future communities. Plus, we may come back and do some things in the future as you move forward. So remember what a community of excellence is. A community of excellence knows where it is, knows where it's going, and how to get there. It also develops strategic partnerships. It also empowers people to act, people just like you. And finally, it's continuous improvement. Because believe me, to build an excellent community, and I've lived in some big cities and I've lived in small towns, to have an excellent community of any size, you've got to stay after it. It's continuous improvement, just like business. So you're walking down the right pathway. I say just pitch in there, do your best, and help these 2 leaders. Thank you very much. Appreciate it.
Mr. Lewis has kind of laid the foundation of why we've been doing the Community of Excellence work for this past year. But we are really excited to have Mr. Sam Creekmore here, a member of our House of Representatives, because he gets to do this work for us, on a state level. And he has looked over our local issues here, and he's going to give us some legislative updates that he knows that pertain to the issues that we've identified here at Eaton County. Yes.
Thank you, Susie. Ms. Whitfield, I liked your list of assets. You left one off.
Okay.
The Tallahatchie River. We cross it, many of us, several times a day and don't think much about it, but it's amazing to have a river that runs right through your downtown. I say that as part of this legislative update. A few years ago, we started the Tallahatchie River Authority, and this year we funded it with $250,000 from the state. And the authority is going to use that money to do a documentary that's already been signed, a deal with PBS, or it'll be aired statewide and possibly nationwide, and feature prominently New Albany and the history of the river. So that's another thing we got going. But I'm going to give you all some updates from this past session. One, you know, we've changed the education funding, and both our county and city schools got more funding than they've had before. And this is a student-based model, so a number assigned to each student, and it's a lot simpler and easier to understand than the old model. We passed the Seizure Safe School Act, and children who suffer from seizures, there's with new technology and development of medicines, there's a nose sniff method that is instantaneous and helps them overcome the seizures. And all the schools have to have training for an hour on a video, and then they qualify for that. You know, in the legislature, we sometimes, we should always have the opportunity to do the right thing. One of the things we did was modernize the language in old bills. The word mentally retarded is part of our law. So we replaced that language with intellectual disability. So it's just an opportunity to do the right thing and modernize some of our technology. Everywhere I speak, I tell them that. I used to get 2 or 3 people to come up and thank us for that. I'm chair of public health, and so the rest of these are kind of on the public health side, but they're important because we're the least healthy state in the country. Our infant mortality is the highest in the country. And so these will hopefully help make a difference in that. One was prior authorization, and that's where insurance companies have these. It was developed in the 90s and meant to be a good thing, but insurance companies have hijacked it. And so if you go for a procedure, you know if you qualify or not, or you get a prior authorization. Well, they've taken their time. There was no timeline for these insurance companies, so they may wait and wait and wait. So we changed that to where if it's an emergency, they have to do it right then. It's not urgent. They have 5 days to make that decision. And if they don't allow it, then the doctor can talk to somebody. It's peer-to-peer. Before, when the doctors want to talk to them how necessary it was to get this procedure done, we could be talking to an accountant or a clerk. Now they have to talk to another doctor. Insurance companies have to provide that. So that's going to help with our health. Presumptive eligibility. As I mentioned, infant mortality is the highest in the country. Presumptive eligibility is for people who get pregnant, they don't have Medicaid, but they're going to qualify for it. And it takes about 60 to 90 days. And as many of y'all know, the prenatal is very important. Well, we passed a bill where you're presumed eligible. And you're able to get that prenatal right then and there. So that hopefully we'll start seeing a difference in our infant mortality. Advanced metastatic cancer. Insurance companies have a method where if you have cancer, you start with the least effective, least expensive medicine. So that works for a time period. Then it's a step method until you get to where you have the most effective, and most likely most expensive medicine available, but it takes 6 or 8 months. If you have advanced metastatic cancer, you're eligible for that best medicine at that point. So hopefully that will help save some lives as well, or will. Breast cancer. 20% of men and women who go have a screening for breast, 20% are called back. 1 in 5 Mississippians actually go back. That's because the insurance won't cover it. We passed a law requiring insurance companies to cover that. So hopefully that will make a difference. Well, that will make a difference in saving lives. And I was so glad to see that mental health was I think, number 5 on the priority list. It's been a priority of mine for a long time. So I'm going to give you some scary stats. Since 2010, depression among teens has increased with girls 145%, with boys 161%. Since 2010, depression and anxiety among college students has increased 106%. Since 2010, emergency room visits for self-harm are up. Girls 188%, boys 48%. Since 2010, suicide rates are up. Girls 167%, boys 91%. We have a serious mental health epidemic, especially for that Generation Z. What happened in 27? The iPhone came out. And it's changed children's lives. They've gone from a play-based childhood to a phone-based childhood. The average adolescent spends 7.5 hours a day in front of a screen. So I think that plays a big part in children's mental health. But since COVID, we've really seen mental health be a real issue in this country and in the state as well. And in the legislature, we addressed it in 2021 with House Bill 1222, which required all police officers, because many times they're the first ones on the scene, to have mental health first aid training. And also a CIT officer in every agency in the state. Y'all may have seen on WTVA a couple weeks ago, a child in Columbus got in a fight with his father, got in a car, drove off with a gun to kill himself. A CIT trained officer showed up, apprehended and talked him down. He obviously didn't do anything, so it's made a difference. But that's not enough. This year, we passed 1640, which changed the screening process. Apparently, if your family turns you in for mental health training, the police would come pick you up, go to the chancery, and then you get a screening. We moved that screening to the front of the process, so it's not near as a traumatic experience to be picked up. And we held the CMHCs accountable. Now, CMHC, there are 12 mental health regions in our state. We're Region 3. The Community Mental Health Center, the CMHC, is located in Tupelo, and that's Life Corps. And they're very, very good, very, very vital. As a matter of fact, they're in every school we have in the county and the city that have represented there. In Region 3, 7 counties. They have a building, an office in 6 of 7 counties. When Mr. Whitfield checked off all the things that we have on our list, that's one thing we don't have. We need, and they're willing to come. I talked to them today. If we provide them a building, which they'll rent, they'll have a presence here, and our mental health people won't have to travel out of the county. It's an easy fix. That's something I'm asking this group to help with, and we can get that done. It's 3 rooms. They're willing to come, but that would make a huge difference for the mental health people in our state, which I may be one of them. We're also looking at teachers receiving the mental health first aid training. Studies show that every child needs an evaluation at least once a year, especially with the statistics I've read. Our teachers y'all are first line, first ones to see, spend more time with them than ever. The quicker you can identify an issue, the better off the health of that child's going to be. And then personally, and we've had 2 hearings on this, we're looking at possibly removing phones from school systems or putting them in lockers where they can't have them out and can't cyberbully during school time. So those are things we're looking at from the state level. When I asked locally, a lot of the school boards said, we don't want to attack that. Y'all do it at the state level, so we won't get the calls. But the biggest thing.
Some's already done.
I work in a school district where it was implemented.
You in Hot Springs?
I'm in Marshall County. I'm in Potsdam.
Yeah.
And I can 100% say having fun without bully lists all day long.
It's being done in Union County.
Yeah.
Good, thank you.
But they are.
Yeah.
And.
Good.
I know
I'm glad to hear that. Thank you
She
for
was
sharing.
implemented in some.
So,
We just enforce what's there.
Enforced, right.
yeah. So the point is, we're seriously looking at mental health in the state, trying to improve it. It is across our state, an epidemic across the country too, but it's not going unnoticed. And we're trying to come up with ideas. The legislature can only do so much, and it really comes down to the community level to help. And if we can get a space for Life Corps, that would really help. And have they been effective in our school systems?
Like four?
Uh-huh.
Yes, sir.
So,
And they're from Houston and here you all.
that's right, Chickasaw County, over 47 counties. And it operates like a clinic. It's in Houston's, where's the location of Life Corps' office? You know?
I don't, they were in our schools.
Yeah, and a lot of them are located downtown. I know we don't have any space downtown. Anywhere we can find would be good. So if y'all could help with that, but that's kind of where we are with what's going on in the legislature on the mental health and public health side. We've done some good things, but I'm passionate about getting the city to be healthier, whatever that takes, and I'm actually very passionate about the mental health aspect of it too. So I can tell you, after spending time with people from all 82 counties and all other members of the legislature, we've got it made here. I mean, we got great people, great support. It's amazing what our community's done, people for us, and y'all in this room. It's made a big difference, but we can even do better. So.
And thank you, Jim. And actually, I will say that first night that we did the community forum, I'm glad to see Kennedy and some of our younger generation here representing, because the mental health aspect came up from our youth that came that night. We had youth here from Union County and New Albany schools. They're the ones who brought it to the surface that night.
Yeah, these are sobering statistics.
Yeah.
Any questions?
Questions for us? We can definitely make that a focus of an effort to try and find space there for Life Corps. And that's a great example of how we can work with our legislation to identify needs from even the state level that can bump down to the local level through this initiative.
Thank you.
Community updates. So really, Billye Jean and I have been working pretty closely together through this initiative for the last year. And let me tell you something, she has a lot of balls in the air like that she juggles here for our area. And one of the biggest things, she and I will be together this weekend for the Mississippi Main Street Association board too. And our main streets are one of the big reasons that you see these communities thrive. And Mr. Lewis can tell you, most of the ones that you see on that population loss list, their main streets are not focal points of their community. So we appreciate everything that Billye Jean does. She's going to give us kind of some community updates again that pertain to the list. And Miss Nancy's going to come up and talk to us a little bit again on the healthcare side. But again, think about the list, because you just don't even know what all she does kind of for the community. That she's really tackling a lot of these topics herself.
Well, and a lot of people ask what I do, and it's hard to kind of explain what community development is and Main Street tourism. It's just such a broad spectrum of everything that falls under that. But I like to say that I am the connection, the bridge between your elected officials, your businesses in this community, and you as a community. And my sole purpose is to bring the community together to make sure that everybody that's in this community feels like their voices are heard, and that I can be the bridge to take your concerns to the people that can actually solve the problem. I work on a lot of things, whether it's historic preservation. We've just recently got the 2 anchor neighborhoods are working on getting them to have historic status. What does that mean? That means that people that live in those neighborhoods, properties, have a designation, and It just helps everybody to be on a standard level where your property rises in value instead of declines. So it's a good thing. I work with tourism and marketing. I work with the parks. I work with the river development. So my title is, it's community. It's just bringing the community together, whatever that means. I'm not going to take up much time because we've got some heartier speeches to take, but I just want to leave this with you, that perception is only a reality if you allow it. And what I mean by that, it's up to you to be active, to be connected, to search the truth, and to bring your issues to the table and not allow other people to tell you what your issues are, or to or put that perception out there that the people that you've elected or the people that are in positions aren't working for you, because that is not true. This community is great because you've got great people that care about the community. And the community is only as good as the engagement of the people that live in the community. So I encourage you to take away from this, to stay connected, to stay engaged, and don't feel like you don't have a voice at the table, because you do.
And if y'all do not follow her, the New Albany Main Street Association, she's constantly sharing stuff. And one of the things, she had a community forum where she brought in some consultants to do some work around town. She invited the entire community to come out, and only a handful, really showed up. So, so she's trying to engage the community more, and I really challenge, some of the diversity in this room to really start to help us get more community leaders in diversity. And that was actually one of the ones. The lack of diversity in leadership came up that night. Ms. Minerva, I believe that was one of the topics that was at our table that night. And I wanted, before I bring Ms. Nancy up, I wanted to highlight how we have kind of tackled that. Ms. Betsey here is a champion that has just spearheaded, leadership in Union County. And if you don't know about this, I want you to know about this before you leave tonight, because our new cohort is about to start now. I'm going to let her kind of tell you a little bit about the diversity that she's seen in those 20 people that we've had in the cohort. But there will be future cohorts of this every year now. So we're going to keep it going, whether Betsey likes it or not. Wait a minute. Don't say your turn.
No, really, y'all. I'm so happy that I get the opportunity to work with this group and this program, because I was fortunate enough years ago, because Pre-Aid and the McLean group at the university had the McLean leadership class. And at the time we visited other towns. We went to West Point, we went to Ridley, we went to Boonville. And y'all, it was at that meeting way back in the 80s, that I first heard about Main Street and saw the first loft apartment upstairs downtown West Point. And I also heard the first rail trail, and I saw a railroad museum.
Here we are.
You got it, and here we are. And then a couple of years ago, through, so it was that experience for me for participating in the McLean leadership class. And it was really funny because after Jill Smith and I got to know each other at the museum, well, she was in the McLean class, and we missed each other, but we both had that experience. So I'm excited that I was along with several others from here, at the commission meeting where y'all put up the Community of Excellence circle or whatever, and part of it was leadership training or developing new leaders. And we always have to be doing that to nurture and bring you up, just like you go through school. You've got to know about your community. And so we kicked it off a few years ago, and then it stopped. And then we kicked it off again because we said it's really time to get this thing moving, and let's do it. So 2 years ago we had our first class, And it's great to see some of those folks in this room tonight. We had 16, we limited to 20 because that's a good number to work with. And then last year, we thought we had the momentum going, but we didn't, and we'll do better. Because this year, we have 20 awesome participants. So the class is full, and some of those new participants are in this room tonight.
Raise your hand if you're one. Raise your hand if you're one. Yeah, we got.
So I'm really excited about the diversity of it, but just it's going to be great. It really is. And so for nine months, we meet regularly once a month. We focus on different areas of the community, whether it's education, industrial development, community development. This year, we're going to add a little preservation and a little tourism twist to it. We do go see here tours. We learn about what's out in our town. We learn about the government, how it's organized, how they operate, why they do what they do, when they do it. And it's fun, and it's really interesting. And then we'll have the leadership development section. We have a session from a group from Memphis that does Dale Carnegie. So if you are afraid to stand up in front of people, you're going to do it, and they're going to grade you, and they're going to film you, and they're going to critique it. And when you leave, you're going to practice what the coach do. So
And we thank Miss Betsey for leading this. It is so much work. I mean, I've been working on it with her. It's a lot of work.
So we're going to have a fun time. And I will say, if any of you are here that don't know about it, we get the information out. I think we started like in the spring to get the information out through UCDA, through the websites, whatever. Call Jan at UCDA or Billye Jean, and just leave them your name and your email address, and we'll send you the packet that they got this year, so it'll give you some idea of what's involved. So if you know somebody that wants to participate, or if you want to participate, and you are over 25, you might be able.
And my superintendent, since y'all are in the room, I highly encourage you. I know we had a few apply this year and get in, and we don't know if we ask your permission or not, but you know, to let more educators be able to do this and have that one day off a month to be able to go through this leadership class. I think that would be wonderful.
We'll visit our schools, visit some industries, walk out of town, train, and then put some of those things in action.
And just to let you know, like, how important, like, one of the, like, Drew and some of the cohort from the first year wrote a $2 million grant that's now taking flight here, called the Reimagine the Park Along the River.
Well, that was the class project, because we kind of already had it said, okay, let's give them something big. And I told them, I said, now y'all, you know, it takes years to happen, but it'll happen. And lo and behold, in a month, you know, they planned Parker-Palooza, and they raised $35,000. Boom. And so because of that, you know, we had to move, and we had to move fast.
The leaders build leaders, and that's what Betsey did. We appreciate it.
Right.
All right, Miss Nancy, so another very important thing about all Community of Excellence is that Mr. Lewis can tell you, this happened in Chickasaw, is that you have to have a strong hospital system. And we do. We have one of the absolute best, and Ms. Nancy's going to give us some updates on our hospital system. And then we're going to do a little brainstorming together.
All right, I have a disclaimer that I didn't know. Billye Jean told me about this late yesterday afternoon. So I didn't have a lot of time to prepare.
She just called me about an hour.
I was like, just call healthcare. That was all I got. So this is what you get. So, but I do appreciate the opportunity to get up here and talk a little bit about Douglas, Union County, we're very proud of our community hospital, and even though we're part of a large 24 hospital system that covers 3 states, we're still a community hospital. There's so much benefit that comes from being part of a large system like ours, and we probably take for granted our electronic medical record. When we implemented Epic back in 2014 and went all electronic, that through that we have the best health information record, and I know Jeannie can attest to this too. And because of that, we've had several hospitals that have joined their system. We had 5 in the Jackson, Atala, Lee area, and then earlier this year we had 2 hospitals from Meridian that joined our system. And a lot of that was because we already had Epic, and so we were able to grow to a 24 hospital system. The benefit that to a small community for us is, I know there's been a lot of smaller hospitals, especially in the Delta, that have closed, and now we have healthcare deserts in the area. And unfortunately for us, being part of a large system, we were able to keep our equipment up to date, the latest and the greatest. New telehealth programs all the time, new MRI, new CT. We added a Da Vinci robot for our surgical procedures in October, and now we're working on adding the second one, so you can have robotic surgery without leaving the county. So we're excited about that, and that comes as a benefit from being part of a large system. I think since they became a part of the Baptist healthcare system, Baptist has invested over $72 million into this hospital alone here. So they're not just letting us stay here on our own and be a small hospital. They're constantly adding more and more things to us, and we're constantly adding physicians. As a nonprofit hospital, and I wanted to, Sam did a wonderful job. We work very closely with him on a lot of the healthcare issues, and he is a wonderful partner. One of the focuses that we do as a nonprofit hospital, that we have to do a documented community health needs assessment every 3 years. And with this, it identifies where those disparities are in our community. And we use that as a roadmap when we're planning community events, whether it's a health fair for children, or it's a baby fair for expectant moms, if it's something that we're doing with youth, or we're doing something with the older population. It is all now focused on these focuses that we have on health disparities, inequities, food insecurities, poverty. When we did the 2022 health needs assessment, it was kind of an eye-opening to realize, yes, that we have a lot of food insecurities here. We have a lot of disparities, a lot of uninsured, access to care. When we did a focus group during that process of pulling that plan together, we had a focus group that we did at the museum, and I was amazed at the amount of concern about the food insecurities and not being able to get in to see a physician, difficult having to wait to get an appointment. So, we put all that in a report to where we're now planning the physicians that we recruit, the specialties that we can bring in here, even if it's a 3-day-a-week specialty that we can bring to prevent people from having to travel outside the community, this inconvenience. Sam mentioned a lot about the mental health, and we've dealt with more of that probably in the last 5 years. I think it became a little bit more significant even during COVID. We even saw more. And we're seeing more homelessness. And it's things that you would not think would be in our community, but it is. It may not be completely visible to everybody, but it's there. And, I have to applaud our social workers, our social services workers, because they're trying to do those mental health places, but sometimes it's in Jackson, and they'll make all the arrangements. They'll have the taxi to come pick the patient up, and they don't want to go to Jackson. If we can get those services here, then they can actually get the care rather than us, they're leaving the hospital and they're going back out dealing with the same problems that they came with, the same concerns that they dealt with. So, we're in the process now of our 2025 community health needs assessment, and we will be sending out surveys to anybody in the community that wants to be on it. That's fine. It is legit. We'll let you know, and it's an email survey, and then we'll be doing some focus groups. But we really look at that. And we try to figure out how we want to tackle one piece at a time. Barbara Owens was one of our quality directors for several years, and she always taught us when we had a big project, you know, how to tackle it. And no matter how big it was, her favorite quote was, "The best way to eat an elephant is one bite at a time." And so she taught us that. So that's what we're doing. The things that we're doing out in our community and the health disparities and inequities that we're focusing on, we cannot do it by ourselves. And that's why I think it's so crucial that we're doing forums like that, to where each one has a role to play. But when we all come together, whether it's working with our schools or working with mental health or just health in general or growing our community, it's going to take all of us as a resources from a standpoint. And housing was mentioned earlier, and I applaud you for bringing that up, because you wouldn't think how something just as simple as housing would impact so many different sectors. It impacts us when the people that we're hiring at the hospital are having difficulty trying to find somewhere to live. I have medical students, and I have to call every favor in. I call Rachel. I have to call everybody that I can find to try to find housing just so we can get these medical students in there. If we're recruiting a doctor and trying to find somewhere for them to live. We need the school systems. We need to grow in our industrial base. And from a UCA standpoint, Jan will attest to this. You know, we want to grow our industrial side of it. We need workers because our unemployment rate is low. We need housing to attract families to come here to work in our industries and our businesses. So it's a group effort, and I appreciate the opportunity to get to talk a little bit about Fabulous. But any opportunity that you want to be, we have a community advisory council, and we would love, Ms. Minerva is on it, and we would love anybody that wants to be on our advisory. And this is where we hear feedback from the community, and then we can share some information about the hospital. And Mississippi Care also has a community connection coalition, and I know several people are involved, and Mark and his team are involved with it. So kudos to these forums, and I hope you do more of that. Thank you.
So we have a wonderful hospital. They actually saved my mother-in-law's life this summer. She had a stroke. Immediately, our response team, EMT showed up at her house. Immediately got her there. Y'all wheeled in some. So you don't have a neurologist on staff. They wheeled in this machine. Some man popped up from California. A neurologist popped up from California. Said she needs that life-saving shot, like the stroke shot, and she got it in enough time, and I'll say, well, she's doing really well. So that's how important our community systems are too. So we've thrown a lot of information out at you today, and just while we have this great group in here, we're going to just kind of end the meeting tonight on just some kind of next steps, what kind of an evaluation now that we're a year in. So what are we missing from that list that's been identified a year ago? What are we missing from that list that we need to focus on moving forward? I think Mr. Sam gave us a great charge trying to find some access to space for mental health, more mental health help here in the area. What is some low-hanging fruit, some easy wins that our Community of Excellence initiative can pull out right now? Beautification has come up multiple times. I mean, Billye Jean already has like this huge list of things that she wants to do all around the community. Who's going to do that work? So beautification can be one. What from our list, have we not done a great job of addressing? There's some that pop out to me, like that I know that I don't know how to tackle, and I need help from people in this room to tackle. So any ideas? We can just kind of open the floor to what y'all want to see this initiative tackle moving forward. Don't be shy.